Good evening. We'll continue with our NEET PG 2024 questions. So it's a big question. We'll read from the last line. What is the probable diagnosis? So try to pick up clues leading to the diagnosis from this big question. A 56 years old male presents with breathing difficulty for 2 months. He also had cough and mucopurulent expectoration for the past 6 months. He has lost 12 kg in the past 6 months. He denies any significant history of fever. X-ray chest showed a right-sided pleural effusion. Rest of the clinical examination and basic blood workup was normal. The pulmonologist performs a USG-guided pleural fluid aspiration. The reports are as follows. So even though it's a big question, the gist is simple. We have to interpret this pleural fluid analysis. Okay. So we will remember the Light's criteria. Okay, so we'll finish the question first. The pleural fluid protein was 4, the serum protein was 7. So the first part of the Light's criteria is pleural fluid protein divided by serum protein has to be more than 0.5 if it is an exudate. So let us divide. Pleural fluid protein in this case is 4, serum protein is 7. So definitely it is more than 0.5. Okay. So the first criteria holds towards exudate. What is the second criteria? Pleural fluid LDH divided by serum LDH is more than 0.6. So our pleural fluid LDH is 230. And our serum LDH is 300. So this also comes around 0.7 or 70%. Rough calculations are enough. So the second criteria also holds good. If pleural fluid LDH by serum LDH is more than 0.6, it also points towards exudate. What is the third Light's criteria? The pleural fluid LDH is more than 2/3 of the upper limit of LDH. So usually the upper limit of LDH is taken as 300. So more than 2/3 of 200 is 300 is 200. So in short, if pleural fluid LDH is more than 200, it points towards exudate. This also holds good in this case, right? It is 230. So if 2 out of these 3 criteria is positive, then it is exudate. If one or none of the criteria is present, then it is a transudate. So once you have differentiated whether it is transudate or exudate, finding the cause is important because transudate is always due to a systemic cause. Any systemic condition causing fluid overload like heart failure, renal failure, liver failure, hypoalbuminemia, etc. will cause transudate. All local causes will cause exudate. There are actually more than 20 causes of exudate if you take it individually, but in short, any local cause, think maybe it could be a pneumonia. The pleural effusion in pneumonia is called as parapneumonic effusion. Tuberculosis is also an infection. It could be pulmonary infarct of pulmonary embolism. It could be malignancy. Anything, any local cause. Maybe one question which they can ask in NEET is, what about autoimmune diseases? For example, in rheumatoid arthritis, there can be bilateral exudatic effusion. Okay. The word bilateral exudate is important because even if you forget this Light's criteria, based on the clinical clues, you can make a diagnosis. For example, you can see in this case, see the clue is very clear. He has cough, mucopurulent expectoration, there is weight loss, it's a long-standing process, and the effusion is only one-sided. So mostly this has to be a local cause. And in India, any cough lasting more than 2 weeks always has to be ruled out for tuberculosis. So the answer here is tuberculosis. See the other three options, CKD, CLD and heart failure, these are systemic conditions. So even if you get confused or if you get tensed by seeing the big question here, the answer is pretty easy to crack. Okay, so transudates are usually bilateral, exudates are usually unilateral, except in rheumatoid arthritis where we get bilateral exudatic effusion. Okay, so this is about Light's criteria and assessing pleural effusion.